Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are talking to April Prunty, who is the Director of Nursing Professional Development at Allina Health, about nurse well-being and building resiliency. So, hi, April. How are you?
I'm good. Good morning. Thanks for having me.
Yeah, good morning. Thanks for being here. So let's
Of
jump right
course.
in. Why is nurse well-being important and how does it affect patient care?
Oh, that is such a good question. Um, when we look at our workforce, our healthcare workforce, nursing and nursing related positions make up about 50%, a little over 50% in some cases. And what we know is that if our nurses and our nursing team members aren't doing well, then they are not in a good position to provide that excellent patient care. So we see a decline in patient outcomes. There is also some evidence to suggest that if nurses are doing well, the rest of the healthcare team is doing well. So, knowing that nursing takes up such a large portion of our healthcare workforce, making sure that our teams are well enough so that they can continue to provide excellent patient care.
Absolutely. And how would you define, in your ideal scenario, what nurse well-being would look like?
Yeah. So I think that's different for everybody.
Hmm.
I think one of the key tenets of nurse well-being is really understanding what well-being means for the individual nurse. So for me, that might look like work-life balance. That might look like opportunities to connect with my team, having downtime to kind of process. And for other nurses, that might look different. We hear from a lot of folks that flexibility in scheduling is really important. They
Hmm.
want to have a positive and supportive environment. So I think it does look different for everybody, but there's some sort of key principles that can be woven, throughout to support well-being.
Absolutely. And how can CNOs and other nurse leaders kind of communicate with their nurses to find out what those specific needs are?
Yeah. So, one of the things that we often hear from nursing staff is they really appreciate visibility. So, and I'm not talking about formal rounding and sort of we know somebody's coming at this certain time and this certain day, but really just taking a few minutes to round on the unit and connecting with the staff. That connection, that human connection, and that visibility is really, really important. That's also an opportunity for executive leaders to hear from their team and say, what do you need and what support can I do for you? So we hear that a lot. I
Mhm.
think continuing to advocate for staff, where at whatever table they're sitting at, to make sure that staff have the resources that they need to continue providing excellent patient care is always important. And I see that a lot in our CNOs across Allina Health, and then with Dr. Carpenter, they just continue to be very courageous advocates for what our nursing and nursing teams need.
Absolutely. So then, in terms of the actual work environment, how
Yeah.
can CNOs build a healthy work environment for nurses that does promote well-being and work-life balance and flexibility and things like that?
That's such a good question. There's a lot of ways I think to do it. Right now, one of the key challenges that we're seeing, across the United States, and I'm going to venture to guess elsewhere, um,
Hmm.
is the increase in violence against healthcare workers. So
Hmm.
our patients require higher levels of care. We're seeing a lot of changes in some of our healthcare settings, and um, we need to make sure that our staff feel safe coming to work and that they're adequately prepared to care for the complexity of patients that we're seeing. So their safety and well-being, that's fundamental to anybody's well-being. So really making sure that we have a safe and supportive environment. I think allowing for adequate breaks throughout the day, making sure that if there's a time when a nurse just needs to take a breather and step away, that they feel empowered to do that, and that they have the support and the resources to step away. Um,
Hmm.
I think the other piece that I hear a lot from nurses is really making sure that the work that they're doing is value add. So
Hmm.
nurses notoriously, will talk about things that sort of bog their time down and takes away from the time that they can spend with patients. So I think it's really important for executive nursing leaders to really think about what are our workflows and what are our processes and how can we improve efficiency,
Mhm.
so that we are maximizing the time that we have with our patients and making sure that we're promoting a healthy work environment.
Absolutely. So, for new and incoming nurses, how can educators help prepare new graduate nurses for the difficulties that they will face on the job? Because as we know, nursing is incredibly difficult.
It is, yeah, and this is really a tough one, and I think we're still learning, the best
Mhm.
ways to do this. So, during the COVID-19 pandemic, there was tremendous disruption to a lot of our
Mhm.
academic programming. So, new graduate nurses were coming in with, not as many clinical hours maybe and not as much experience. And
Mhm.
so I think it really is an opportunity for us to think differently about how we bring people in and help them through that transition. We have
Mhm.
a really strong nurse residency program. So our program manager, Amanda Forsyth, has really leaned into what the nurses are saying they want and they need, and really kind of paying attention to the new generation of the workforce. So we're talking a lot about moral distress, moral injury,
Mhm.
processing grief and loss, having crucial conversations. So things that are really challenging for folks as they enter the nursing workforce. The other thing I would add is this again is really an opportunity to lean into academic partnerships. So where
Mhm.
we have an opportunity to really understand, from a clinical perspective, what do the academic programs look like, and vice versa. So our
Mhm.
academic partners, what are we seeing kind of on the clinical side, and where do we have opportunities to partner and maybe think differently about how we transition folks into the workforce, how we, even welcome them to the profession, in their very first program. So, I think it's caused quite a shift in how we
Mhm.
prepare nurses, and we're kind of trying to remain agile, which I think is incredibly important. I would say the agility and curiosity in approaching the needs of this new workforce are going to be critical to make sure that they
Mhm.
have what they need to take care of patients.
Absolutely. Yeah, I've heard a lot about nurse residency programs through
Mhm.
talking to a lot of CNOs. It seems like the right path for sure.
It is,
Um,
yeah, it's just an extra level of support, I think, and, there's a lot of different
mhm.
ways you can structure your residency programs, but, what we have found that our nurses really appreciate is just the opportunity to build community with people who are,
Mhm.
going through similar experiences.
Absolutely. So I want to touch on that processing grief and loss piece that you mentioned. So how
Yeah.
can CNOs and nurse managers support nurses on the job if they do need that moment to kind of step away and process?
Yeah, that is so important. We are incredibly fortunate at Allina Health. We have an incredible spiritual care team.
Mm.
So my team in particular works with three of our chaplains who oversee the spiritual care staff across the system.
Mhm.
And we're really thinking about ways and pilot testing some different ways that we can support staff in real time. So there's a few different phases to supporting staff who may have experienced a traumatic event or really high stress situation. So there's an opportunity to provide support in the moment. So
Mhm.
making sure that it's sort of like I mentioned earlier, that people are empowered to say, I got to step off the unit for a few minutes, like I need to catch my breath. Having a
Mhm.
colleague there that says, yep, I got your back, go take a break, or a leader or manager. I think the other piece that's critical is, how do we help those individuals process what happened? So,
Mhm.
the we need to be attuned to the impact of the experiences that our nurses are feeling, and that's really where we rely on our partners in spiritual care who do rounding daily on our staff and make sure that they're helping. Provide a set of listening ears and kind of helping them process through those things. And it can be an informal meeting and a check in, and then it can be through some more formal programs. So, our chaplain team created this beautiful framework that they've tested and had incredible success with. That they refer to as AID. So it's acute
Mm.
incident impact debriefing. And it's really just a series to help people in the moment kind of process what they've gone through. And then they also provide that follow-up support. So we're
Mhm.
incredibly fortunate to have partners there. We also have employee assistance programs and that kind of thing. But, I think the importance is having the support and resources in the right place at the right time, which is something that we're paying really close attention to.
Absolutely. And that is the perfect segue to my next question, which is what resources should be available to nurses on or off the job to assist them with matters of health and well-being?
Oh, so good. How much time do we have? This we could talk about this alone for
Yeah,
longer.
for sure.
Um, So, this I think this is really where we have an opportunity to lean in to the staff and, be
Mhm,
flexible and try some things. So, a few of our sites across the system have calming rooms, for example, or relaxation rooms. So, it's a space that, you can listen to calming music, or you can go and kind of meditate and take a deep breath. So, just a space where you can physically close the door and sort of separate
mhm,
yourself from, maybe what's happening on your unit or in your clinic. So that's always an option. We do have formalized employee assistance programs through our employee benefits program. We also have a great, pretty robust employee well-being program through our Penny George Institute for Health and Healing. So
mhm,
staff can receive coaching on a variety of topics. They have access to kind of on-demand asynchronous learnings that they can do. I mentioned spiritual care earlier. And then I think the visibility, just making sure that
mhm,
executive leaders are present and really listening to their staff. Um, Everybody needs something a little different. So, like I said, I think this is really our opportunity to say, okay, what's working, what's not working, and it's okay. We can try something else. So, I think the challenge that we still need to solve for in a lot of ways is the time. So
mhm,
nurses are very busy, patients are very complex.
mhm,
So, how do we empower nurses to take that space and to take that time during work, after work, separating themselves, from the day, and then coming back rested and refreshed the next day? So, that's I think a challenge that we're still trying to figure out.
mhm.
But that I am confident that we, will continue to support and figure out ways to continue to support our teams.
Absolutely. And so, how do you communicate to staff that those programs do exist, and how do you give them pathways to kind of find them and engage with them?
Yeah, so this is a great, probably $10 million question, because what you will find is it depends. So,
Mhm,
nurses work long shifts, right? 8 hours, 12
mhm,
hours. There's not always time to check email like a lot of,
mhm,
traditional modes of communication, right? Email, check your email, you'll get the message there. So we've
mhm,
really had to think differently about how we can get the message out to folks, knowing that we're a 24/7 operation.
mhm,
So we have a few different venues. So email is still used, but I would also add that we have an incredible communications team that puts out weekly communications to all staff. We
mhm,
also have what are called tiered huddles. So these are really focused on safety issues. So it's the team coming together for a brief period of time throughout the day and really escalating, what's happening now, what are we anticipating in the future, and to raise any concerns at that time. So that's a moment in
mhm,
time where the team can kind of connect quickly. We also are looking at ways to integrate resources into our electronic health record. So I'll give
mm,
you an example. My team manages an internal SharePoint site where we have a lot of resources for staff. What we
mhm,
have been able to do is integrate that site through a button within the electronic health record. So staff don't have to, close out of the health record and find something else. So when they are documenting on a patient and they have a question or need a resource, it's kind of there at the click of a button. So
mhm,
technology is one way to do that. We also have a pretty strong social media presence. So we try to encourage our staff to follow us on social media to find out what's happening, and then signage, so signage is always an
Mhm,
opportunity too. So we, inadvertently messaging gets missed, and
mhm,
that's something that we will, like I said, just continue to solve for, and figuring out new ways of how people like to receive communication, what's the most effective way to receive communication. And I think as our health system continues to grow in complexity and expand sort of in geographic areas, we really need to think about how can we reach all of our staff, because that's part of feeling included too, right? Knowing what's going on and not feeling left out of messaging. So
absolutely, yeah. So we've talked a lot about concrete programs and things like that,
yes.
solutions in that way. So what are some positive things in general that CNOs or other nurse leaders can do to kind of just keep spirits high in the work environment?
Yeah, so this is so important, and I appreciate you asking that question because so often we don't have the opportunity to sort of reflect on what's going well, and what we can kind of just continue to do, to
Mhm,
keep our teams healthy. So, um, I mentioned visibility earlier. I think rounding and making sure people see you as a person,
mhm,
and you make that connection with your teams is critically important. I think continuing to advocate, in whatever venues and spaces we can is really important. The other piece that I would add that I am just incredibly proud of our CNOs that they continue to do is really helping people outside of the discipline
mm,
understand and tell the story of nursing. So, what does
mhm,
a nurse's role look like? What is the invisible labor that's associated with providing excellent patient care? And how do we recognize and acknowledge, the important part that plays in the care that we provide every day? Um, and because it's really hard, for
mhm,
people to explain your day as a nurse. How was your day today? It's like, well, so yeah, so I think any opportunity to just be curious and help people understand and tell our story as nurses, I think is really important. And yeah, I think our CNOs are doing an incredible job of that, and it's been really nice to see kind of how that's evolved.
absolutely. Well, that is a beautiful note to end on. So thank you so much for your time, April. I'm really grateful to have had this opportunity to get to know you and hear your insights. And thank you to our audience for listening.
It was awesome to meet you. Thank you so much.
Yeah, you too.